Alright, so now for the next drug which we'll get to discuss, its pharmacology, is what is known as enfuvirtide. This one is a very popular antiviral drug. Enfuvirtide. Okay, enfuvirtide. So it's usually called Fuzeon. Okay, Fuzeon. So for enfuvirtide, just so you know, it's an antiretroviral drug. When you say a drug is an antiretroviral drug, it's used in treating HIV. Okay, so it's used in the treatment of HIV-1 infection. It is unique as the first and only fusion inhibitor. When you search fusion inhibitor types of HIV drugs, you see just enfuvirtide. So they found only it and they haven't found a replacement. So it's approved for HIV therapy. It acts at the stage of the virus trying to enter the cell. Let me explain something. As the virus is trying to enter the cell, it first of all gums on the cell membrane, okay, before it goes in. So this one is a fusion inhibitor, meaning it will stop the virus from even binding on the cell. Okay, so looking at the drug profile properly, is a HIV-1 fusion inhibitor. So enfuvirtide binds to the GP41 subunit of the HIV envelope glycoprotein. It will now prevent some changes that would have come in that would have made the HIV virus to be able to bind to the, what do they call it, to the cell membrane. Do you understand? So this will now block the HIV from entering the CD4 T-cells, which are very important for your immune system. So it will halt the infection even at the point of entry. So it's a fusion inhibitor. Okay, so it's a very good drug, right? So pharmacokinetics, they usually give it through injection, and the injection is under the skin. They call that a subcutaneous injection. Absorption, peak plasma concentration in about 4 to 8 hours. Distribution is widely distributed. About 92% will be protein bound. Excretion, peptide fragments, they are eliminated via the renal pathways. Okay, so half-life is about 3.8 hours. Okay, so therapeutic uses, just HIV-1 infection, but it's actually life-saving. Okay, so it's always used in combination with other drugs. So as you are giving this drug that have this particular mechanism, you are giving another drug that has another particular mechanism and all of that. So adverse effect is just you give it under the skin, so sometimes you can have reaction at the site of injection, like pain, erythema, nodules. Okay, so sometimes the patient might feel weak, sometimes the patient might have some troubles sleeping and all of that.